Hey guys, Millie Fox here. I thought what better time to start vlogging than during a pandemic. I mean, I've already got my channel up, but I just haven't posted a vlog yet. I am 29 weeks pregnant as of Friday. I'm currently on my way to a midwife appointment, which I had canceled from yesterday because I was supposed to come in and do the gestational diabetes test, which would involve me sitting in the waiting room for about 45 minutes. And I have a pretty low risk of GD, so my midwife and I made the decision together that at this time we're not going to do the test, and we did most of our appointment over the phone so that I wouldn't have to be in the office for very long. So today I'm just going in to listen to the baby's heartbeat, get my blood pressure taken, get measured, all of those things. So it's just a quick 15-minute in and out trip. I am going to be wearing a mask and gloves. The information out there is so unclear right now of whether we need to be wearing masks or not, that we should be saving them for healthcare professionals and whatever. But you know what? If I'm in a vulnerable population by being pregnant, then I'm just gonna wear the mask. We're not hoarding masks. We have some from back when we had other illnesses and whatnot. So I'm gonna wear the mask. And we've also decided with my midwife that we're going to skip our next visit in 2 weeks and just do the 32-week visit, because with a low-risk pregnancy, there is information that says that the 30-week visit is not necessarily needed. So we're going to do that. And other things, I'm really not feeling afraid, not feeling afraid for myself, not feeling afraid for my family directly, except for grandparents. I am really pushing on the family to start taking lockdown precautions, and I don't think we should see grandparents for 2 weeks from today, since all of us are doing our last out in public sort of errands today. And if anyone needs to deliver them groceries, it's going to be a outside the door type situation. And I mean, here's the thing, anybody under the age of 50 doesn't really need to have any kind of fear for their life at this point. The people that we need to be concerned about, and the reason why we're all staying inside and social distancing and all that stuff, is because we need to take pressure off of the healthcare system, and by reducing our community spread, because they have now proven that the virus can be transmissible via people who are asymptomatic, meaning if you don't feel sick, you could still be giving the virus to somebody else, right? So even if you have zero symptoms, you could be in a pre-symptomatic stage of the virus where you're carrying, and you could be passing it unknowingly. So we are trying to just flatten that curve, stop the spread, to avoid situations like what's going on in Italy, and to give the healthcare system relief and give our elderly population a much better chance of making it through, because from the last data that I read, anybody over the age of 80 has a 14 to 20% death rate. So that's really high. So we're not doing that because we're afraid for ourselves. We're doing it because we're being responsible. It's the responsible thing to do. And also, even though it's not all going to be elderly folk heading to the hospital, the more people that have to head to the hospital, the less we will be able to help the most critical cases. So guys, I've seen the meme floating around, your grandparents were called to war, you're being called to sit on your couch. We can do this. We can absolutely do this. We need to just pause the world for, a couple of weeks and see how it goes, and see what this virus is going to end up doing. And I was super happy that I heard a state of emergency was declared today in Ontario by Doug Ford. I still think that we should all kind of just be in lockdown as much as possible, especially if you are, wanting to interact with the elderly people in your life, or anyone who is of a vulnerable population. I know there's not a lot of information right now about how this is really affecting pregnant women or infants, but I did just read a study that shows that out of all of children like under 18, that infants do have the most severe cases because they haven't had any time to develop any kind of immune system yet. So I did see a newborn diagnosed with COVID in London. Not sure how that's sort of playing out right now, but there are some stats that say, you know, that this cases of infants, I think it was like under the age of 3 or something like that. I'll post the link to this study that I read in the description box here, but it's more severe. There's more severe cases in infants. So yeah, I mean, I don't know what's going to happen. I don't know if there's going to be still circulating virus in 3 months when the baby's born, because I'm due first week of June. But you know, up until that point, I guess I'm just gonna cancel pretty much everything, which sucks, guys. Like, we had to cancel a trip to Anguilla. I've canceled my maternity photo shoots. All of my shows for my business have been canceled. The baby show, you know, mompreneur conference, like everything that I need to get up to is basically off my plate. So that's it. Like, we're just gonna do our best to enjoy this like yin time, because if we're not, you know, out in the world being super productive and, you know, masculine, go, I'm just gonna take it as a lesson in embracing yin energy, and what better time to do that than during pregnancy. I just want to reinforce the message that you don't have to take advantage of this time. You can just be, instead of like, oh, I gotta get a head start on all my spring cleaning now. I need to feel guilty if I don't, and all of that crap, that whole narrative. Like, if you're inspired, please go ahead and create. But if you feel like super relieved by this situation of just being able to stay home with your children and operate at a lower frequency, then embrace that, because it's not probably going to happen too many other times in your life. So that's all I have to say. This is my quick little vlog situation, pregnant in a pandemic, and I'd love to hear your thoughts. Are you pregnant? How pregnant are you? And what are you feeling? Are you afraid? Thanks for watching, guys. Please subscribe to my channel. Please give this video a thumbs up. Share it with someone else who is pregnant that you know, because really, we shouldn't be living in fear right now. We should just be doing our best and keeping a hopeful outlook. So stay healthy, and talk to you soon.